bowel disease, because today is World and Inflammatory Bowel Disease Day, IBD we call it as. So there is an increased research and studies going on in the field of inflammatory bowel disease worldwide. Why? Because the incidence of inflammatory bowel disease is increasing day by day. So coming to what is exactly is inflammatory bowel disease. It is inflammation of part of GIT or a whole of GIT, that is gastrointestinal tract. If there is an inflammation ongoing, we call it as inflammatory bowel disease. So what are the factors why inflammatory bowel disease is increasing recently? What are the factors responsible? So the etiological factors are genetic. Some genetic genes like HLA and MHC association has been found in families who are suffering with IBD. Second, there are genetic polymorphisms which lead to dysregulated immune response. Our body's immune response behave differently to simpler stimulus. So usually some families have this genetic association. Those families have increased incidence of this inflammatory bowel disease. And the second being the environmental factors, the food we take, the diet we consume, the increased westernized diet. Recently, in recent couple of decades, we are seeing increased westernization of our diet, which may be responsible for increasing incidence of inflammatory bowel disease in India. And smoking is one of the most important factor, because smoking has shown doubling of the incidence of inflammatory bowel disease. And some of the drugs like oral contraceptive pills, usage of hormone pills have increased incidence of this inflammatory bowel disease. And stress, day-to-day stress, increased competitiveness, lack of proper physical activity are some of the factors which are act as a trigger for this inflammatory bowel disease. So among the populations of the world previously, until 2 decades ago, IBD is thought to be a disease of the Western population, that is US, Canada, UK. They have increased prevalence as well as incidence of IBD. But in the last couple of decades, the incidence has been rapidly growing in India. Maybe because of rapid changing lifestyles, rapid westernization of our dietary patterns, increased usage of preservatives, frozen foods, and increased usage of fertilizers during cultivation, lack of proper monitoring of the effect of these things on the long-term health of the person is lacking in India. So maybe these are some of the factors why IBD, inflammatory bowel disease, is increasing in India in the last couple of decades. And the third one we can say is because of the microbial floral alterations, that is our intestinal microbes, that is intestinal bacteria gets altered either by usage of recurrent antibiotics or because of cross contamination of the bacteria by the food. So our microbial alterations, luminal alterations of the bacteria plays a very important role in inflammatory bowel disease. Fourth one is our immune response. Our immune response behave excessively to simpler stimulus, like even some allergens in the food is excessively reacted by the body, which can cause ulcerations of the intestinal mucosa. So what happens in inflammatory bowel disease? That is, there is inflammation, that is body react excessively towards a simpler stimulus like microbial pathogens, and they cause ulcers to our intestine. So what are the types of inflammatory bowel disease? Any categories? It is divided broadly into three. First one is ulcerative colitis, we call it as UC. The second one is Crohn's disease, CD. The third one is unclassified. It can turn either into ulcerative colitis or Crohn's disease as the disease progress. So what exactly how they are classified? So in ulcerative colitis is, as the name indicates, it is an ulcerative disease of colon, that is large intestine. So the large intestine gets affected predominantly with the formation of multiple superficial ulcers, continuous pattern of ulcers with excessive bleeding in the stools they present as. Whereas in a Crohn's disease is a disease of small intestine or large intestine or even the stomach. So Crohn's disease can affect any part of our gastrointestinal tract, and predominantly it affects the small intestine. However, 50% can have a large intestine involved. So these are like briefly ulcerative diseases of small intestine and large intestine we call. And what is the exact age group who are affected by these inflammatory bowel disease? So in Crohn's disease, we have a bimodal age of presentation, like children or even adults, adolescents up to first 2 decades, 2.5 3 decades. First 3 decades they have a high peak in Crohn's disease. Later, followed by the fifth decade people, like people who are older above 50 years can have increased incidence of Crohn's disease. Even children, we are seeing increased number of children less than 10 years getting inflammatory bowel disease, that is Crohn's disease, in India in the recent times. So, whereas ulcerative colitis is usually middle age, like 20 to 40, the population trend is like middle age. Working population are likely to get inflammatory bowel disease like UC, ulcerative colitis. So, since ulcerative colitis, how do they present? What is the clinical presentation of this group of population? We discuss separately as UC as well as CD, ulcerative colitis and Crohn's disease. In ulcerative colitis, usually the person presents with weight loss, increased frequency of stools, bloody diarrhea, bleeding in the stools, and urgency to pass the stools, and tenesmus, that is painful defecation. We call it as painful stool passage, and inadvertent weight loss. However, how much they eat, they have increased weight loss with ongoing diarrhea, and they have this hypotension, they have anemia, that is because of frequent blood loss in the intestine. Usually they present with generalized weakness and anemia. These are the features of UC from GIT, that is gastrointestinal symptoms. UC can also have extraintestinal manifestations like Ephthus ulcers in the mouth. They have smaller ulcers, Ephthus ulcers in the mouth, and they have red eye, on and off red eye, that is scleritis, redness of the eye, conjunctivitis, and arthritis, like small and large joints can get affected. So these are some of the extraintestinal manifestations. Skin lesions like erythema nodosum, we call it as. So these usually present as an abrupt diarrhea with extraintestinal arthritis and uveitis, we call redness, conjunctivitis. So what people tend to do is they use over-the-counter medicines for diarrhea very frequently. Multiple antibiotic doses they take to reduce diarrhea, and over-the-counter anti-diarrheal agents they used to take. By the time they present to the hospital to us, it may be very late. So we should not neglect if the patient has recurrent diarrhea. They should be brought to medical attention if the patient has blood in the stools, urgency, or painful stool passage, or weight loss, or shock, or hypotension. We have to get medical attention. Whereas Crohn's disease, that is the second type of inflammatory bowel disease, which is common in children, adolescents, as well as older age group, they present with pain abdomen. Predominantly, they have pain in the central part of the abdomen, After food intake, they have increased episodes of pain. Then they can have increased stools, like increased stool passage, increased frequency of stools. They can have vomitings, nausea. They can have weight loss and generalized fatigability and weakness because of blood loss. So blood loss is common in both the entities. They present with lack of well-being, fatigue, and malaise. They cannot perform their routines very actively. So what exactly is responsible is there is formation of ulcers in the intestine, small intestine or large intestine. There is increased ulcers formation with intestinal wall edema. That is, there is swelling of the intestinal wall, which can cause abdomen pain, distension, and there is poor absorption of the nutrients. Whatever food the patient might take, it is poorly absorbed. So the reduced digestive capability of the patient is one of the features. And there can be, they can present with even the manifestations other than the intestinal manifestations, like arthritis, joint pains, small joints, large joint pains, conjunctivitis, redness of eye, very recurrent episodes like scleritis. They can have watering of eye, and they can have this skin lesions, red skin lesions, which are very painful, especially over the bony prominences they can have. So these are some of the extraintestinal manifestations of IBD, that is inflammatory bowel disease. Why it is important to diagnose early? Why? Because if we do not diagnose it very early, there are chances that patients might have increased blood loss. They become very weak. The bones become weak, osteoporotic or osteopenic because of calcium, vitamin D deficiency in the diet, as well as poor absorption of nutrients. So overall general well-being of a person or a patient is grossly affected if it is not detected early. So Crohn's disease, especially in the children, we have seen children of 8 years, 9 years, 10 years coming with severe pain abdomen. When we evaluate them, they might have small intestinal ulcers. So these can lead to reduced growth in children. They have poor weight gain. They have poor learning abilities in the school. Why? Because since they are weak, since their appetite and blood percentage is very low, they cannot concentrate. They lose weight. They lose nutrients. They become weak. The bones become weak. So their overall growth and mental well-being is grossly affected if we don't diagnose it early. So any children, if they have severe pain, if they have low blood percentages, we have to evaluate an intestinal cause like inflammatory bowel disease. So what are the main features in IBD? How we diagnose? Whenever a patient with chronic diarrhea, that is, patient who are having increased stool frequency or urgency or painful stool passage or blood in stools or vomitings or nausea, or weight loss with fatigue, fever on and off with abdominal pain episodes, they should be brought to medical attention and investigated thoroughly. We should do examine their stool examination to rule out any infection like amoebiasis or other CMV infection which can have a similar presentation as IBD. They should be done blood investigations which can detect the cytokines, that is the inflammatory process which is responsible for IBD, like increased C-reactive protein, ESR, and blood count should be monitored. Hemoglobin percentage and iron profile should be done. In severe diarrhea, bloody diarrhea cases, we should do a sigmoidoscopy, that is in test which helps in examining the large intestine. So this large intestine, when we examine by sigmoidoscopy or colonoscopy, can show us ulcers in the large intestine which may be bleeding, or there can be like polyps which is responsible for these manifestations. So we try to take multiple biopsies from the from the colon through colonoscope or sigmoidoscope, which helps in differentiating us whether it is ulcerative colitis or tuberculosis or Crohn's disease. So they have a similar presentation in most of them. So we have to take a biopsy for diagnosis for a compulsory. So what exactly do we have any treatments for this inflammatory bowel disease? Yes, we do have multiple modalities of treatment recently. We have to uh, delineate that stage as either mild, moderate, or a severe disease course. And first, in order to delineate, the above set of investigations will help, as well as we will take the help of a CT scan of the abdomen, which helps in delineating the severity. So what are the groups which are available for the treatment are 5 ASA, simple tablets. ASA group of tablets can help in reducing the intestinal inflammation and healing of ulcers. Once the ulcer heals, the bleeding reduces, the pain reduces, the swelling of the intestine reduces, and the patient gets relief. We will use immune suppressants like steroids for a short duration, like 2 to 3 months, followed by immune modulators for a while, like 3 to 5 years. We use immune modulators. And last resort, if the patient is not responding to all the modalities, we will try to take the help of biological agents. We have biological agents where they will be given 2 times a month or once in 6 weeks on a scheduled basis, and we will try to induce them on biological agent. These are very powerful drugs which target the immune response of the person. That is where the immune body excessive immune response can cause damage to the intestine. They will be targeted by biological agents. So we have several biological agents which are available. And the newer one is the fecal transplantation. We will try to transplant the feces of one person, that is a healthier person, to affected person, which will correct the intestinal bacteria. The flora is corrected in the affected person. Of course, these are in the trial basis. It is not routinely available in all the hospitals. And the last resort is the surgery, when the person is not at all responding to all these modalities. If they are like dependent on the steroids, if we will try to do surgery, and we will remove that part of intestine. So these are the modalities which are available. And patient education is very important in case of inflammatory bowel disease. Why? Because what is the exact reason for IBD is multifactorial. It is not a single factor which is causing this disease. It can be environmental trigger or a genetic cause or a body's immune response which is responsible, or the dietary factors, or family history. These are all the factors which play in the etiology. So it requires a well patient education. Why? Because the treatment for the inflammatory bowel disease is usually a longer duration. Like it might take 3 to 4 years. Sometimes in a severe disease course, it may be lifelong. So very patient, very we should be very educated and aware of the disease course, because it requires constant supervision, constant surveillance by expert doctor, as well as counseling of the family members is required in management of IBD, that is inflammatory bowel disease. And how will be the course of inflammatory bowel disease? So the course can be like, in some people there can be episodes like once in 2 to 3 years they have this attack of intestinal bleeding, ulcers, edema, pain, and blood loss. And later with the treatment they settle down, and for a couple of years they can be okay, and then they can again have an episode. So this is called as like a relapsing and remitting course. That is, the disease comes, exacerbate, and they reduce, and for a couple of years they will be all right. And sometimes the disease in this is the first scenario. In the second scenario, the disease can be continuous. That is, the patient might not respond to the agents well. They might require repeated antibiotics, steroids, immune modulators, and biological agents, in spite of which they present to the hospital in one way or the other with weight loss and abdominal pain, they have a continuous course, that is poor response to treatment. Third group is a single episode, that is they can have a single attack following the treatment, which they don't present again to the hospital, which is a very rare scenario. So we have to be aware of the disease course, which disease course we are having. Yearly checkup, even though you are in remission, try to be annual checkup with the doctor and try to monitor the disease by means of colonoscopy or sigmoidoscopy and periodic surveillance, because ulcerative colitis can cause cancer in the long run, that is more after 8 to 10 years the person can have malignancy changes, cancer changes in the intestine. So thorough screening by means of routine colonoscopies is advised, and we have to monitor the disease activity. Why? Because it affects the overall health of the person. We should make sure the ulcers heal off at a molecular level, that is we call it as microscopic healing. So we should try to achieve the microscopic healing level for the patient to be well. So there are several foundations which are working worldwide for management of inflammatory bowel disease. So why? Because it is not a disease of a single episode like malaria or dengue. It doesn't go away as of a sudden. It when it occurs, when the disease is diagnosed, it might take like years to completely remit. In some scenarios, they can respond very well. In the early scenario, they will respond very well. Especially in children, we are seeing Crohn's disease where they respond very poorly. They have multiple relapsing remitting. They have frequent attacks of abdomen pain and discomfort, and they have complications like the intestinal lumen closes because of ulcers and healing, that is stricturing disease, and ulcerative disease, which may require surgical management or biologicals, that is injections once in 2 weeks or 4 weeks. We may have to give them biological therapy. And most commonly, which is neglected, is Crohn's disease in the anal area, that is perianal area. Usually, the perianal area is one of the neglected part. Why? Because they present as a fissure or fistula or bleeding in the stool. Usually, they tend to get treated locally as if they have a fissure or a fistula or infected fistula tract. But when a person have multiple fistulas, like 2 or 3 fistulas, even after surgery, they are having the recurrent attacks. That is, there again and again they are getting fistulas. Then they have to check. There can be underlying Crohn's disease. So if they have an intestinal Crohn's disease, they can present externally as fistulas. So recurrent anal fistulas should be thoroughly investigated in terms of Crohn's disease. So Crohn's disease is one disease where the whole of GIT, stomach, small intestine, large intestine, can get affected, even in the perianal area. So we have to be educated regarding the disease, and we have to be cautious, and we have to be well aware. If the patient has a chronic diarrhea, chronic weight loss with blood in the stools, with abdominal pain, we should consult a gastroenterologist for checking the intestine to rule out any inflammatory bowel disease. Coming to the second one, which can have an overlap of symptoms, is IBS, that is irritable bowel syndrome. So IBD is inflammatory bowel disease, IBS is irritable bowel syndrome. These two are separate extreme spectrum of the same symptoms. They sit at the extreme spectrum of the same symptoms. So even in IBS, they present with abdomen pain, either diarrhea or constipation, lack of appetite, and poor well-being, poor health status of the person. So these two are separate entities which should be differentiated based on the patient history, examination, and investigations. So please be educated. Let us all be aware of inflammatory bowel disease, which has been increasing in incidence and prevalence in India. especially in the younger population. We are seeing more numbers. So try to be aware, try to stay away from processed foods, processed meat, and try to be healthy, hydrate yourself, be physically active, reduce your stress levels, be cautious, be alert to your symptoms, don't neglect your health, don't neglect the food you take. Try to take everything in uh, fresh state. Avoid frozen foods and frozen meat, and let us all pledge towards well management as well as diagnosis and treatment of inflammatory bowel disease. As a doctor, we will be available round the clock to attend the patient symptoms, and we will stay focused towards the management of IBD. This is my pledge. Thank you. I will be available in KIMS Kondapur Hospital from morning to evening. So kindly meet us if you have any further doubts. Thank you.